we are going to talk a little bit about the Young Leader Council team. Who are they? Who we are, why we were created. So the Young Leader Council was created to bring together young professionals, recent graduates, and graduate students globally. Right now we have members from 15 countries and 7 different disciplines. Next slide, please. Thank you. At the Young Leader Council, we believe that global health is more than just a field of study. It is a growing movement that challenges us to think and a challenge to find new ways to find solutions for today's public and global health issues. Since we started in the late 2022, the Young Leader Council has grown from just 3 founders to a passionate team of 14 members from different countries, all committed to promoting global health equity. We host coffee chats, webinars that navigate vital health topics around the world. We have bi-weekly discussions where we discuss global health topics. In 2024, for example, we organize sessions on mental health challenges in Kenya specifically, which included a respected expert who share insight into the cultural systems and policy-related factors influencing mental health. Outside the discussions, the Young Leader Council also support the GHA through events planning, creative marketing, fundraising, and support collective advocacy for global health, equity, and awareness. Next slide, please. Okay, so how can you connect and what benefits you can get through joining the Young Leader Council? You can get networking, mentorship, amplify your voice, of course, diverse connections, and shape the future. Okay, now it's my pleasure to introduce the panelists, inspiring leaders and global health experts from different parts of the world. Let's start with Dr. Nivantha Naidoo, a physician and scientist with over 15 years of experience in the global healthcare landscape across the EU and beyond. Her expertise spans real-world evidence generation, data analytics, and building sustainable partnerships that connect medicine, epidemiology, and innovation. Her specialty area focuses on evidence package, gap analysis, and integrated evidence generation strategy. Also include the PPAES and PPAS. She has a degree from Walter Sisulu University, a master in public health in epidemiology, and Paris Descartes University, a master in comparative research methods. Dr. Naidoo brings a truly global perspective of how research and innovation can transform access, outcomes, and impact in public health. The second panelist that we have is Dr. Prachi Pundir. She is the co-founder of Collaboration for Evidence Synthesis and a research fellow with the George Institute for Global Health. With more than a decade of professional experience, she has contributed and led evidence synthesis work in several national and internationally funded projects as a part of diverse and multidisciplinary teams. Her research interests include evidence synthesis methods and innovations, mental health of healthcare workers, maternal and child health, and the use of AR in evidence synthesis. Her work has been published in leading journals, including B&J, BNC, and PLOS ONE. Next, we have Dr. Farah Shroff. She is a visionary Canadian, public intellectual with expertise in global public health research and education. She envisions and strives for health for all on a healthy planet. A policy expert, she has worked within and for many governments in Canada and elsewhere. She founded and leads Health Together, formerly known as a Maternal Infant Health Canada, a global public health collaborative aiming to improve the well-being of women, young, and the environment. Harvard School of Public Health recently awarded her a mid-career fellowship, recognizing her expertise in global public health. She works as an independent consultant, faculty member at the University of British Columbia. More recently, she was appointed to the governing board of the Vancouver Coastal Health Authority. Last but not least, we do have Wendy Jolley-Kabi, GHA President and CEO. She is an experienced leader of international health and development organizations. She has a proven track record of engaging diverse stakeholders in responding to emerging challenges around the globe and is committed to supporting the transformational knowledge and creativity of local communities. Wendy graduated from Cambridge College with a double BA in Political Science and Religions and an MPA from Villanova University. She is also a graduate of the Montgomery College Nonprofit Leadership Institute and served as a Peace Corps volunteer in Lesotho. Wendy's passions for global health equity extends for her career across social justice, community development, and child protection work. She is dedicated to creating new ways of supporting and amplifying the voices of frontline global health practitioners, believing this is the key to transforming health for communities that are more often ignored. Once again, thank you all for joining us. I will pass it over to Alisar.
All right. Thank you so much, Aida. And thank you so much to all of the panelists as well for taking time off your very busy schedules and joining us in today's webinar to talk about different careers that young professionals, students, older professionals, what have you, might be interested in. And also would like to thank the audience and having so many of you join us. And I'm excited to hear everyone's input throughout the discussions. So we're gonna start with the moderated Q&A session. So the way it is going to go is that we are going to start off with a few questions that we have all panelists answer, and it'll be a kind of pass the ball kind of way of answering the questions, and then we'll move on to panelist specific questions. So we'll have Nivantha, we'll have Dr. Shroff, we'll have Wendy and Prachi answer a specific question that we have for them. And after that, we'll have a very short intermission and we'll go on to the live Q&A session. So any questions that the audience may have, feel free to add them in the chat box. And also, if you are courageous enough during the live Q&A, feel free to unmute yourself and just ask the question out loud. Any questions that we might not get to, we will try to get back to you by email, but we'll try to have as many questions answered for that. So without further ado, we're gonna start with the questions. And I have a few note cards here, questions. I really wanted to have that. So the first one will be, what experiences earlier in your career helped you the most understand how to influence and improve public health? And for that one, I know that where we want to have Dr. Shroff answer as many questions because she won't be able to stay with us for long. So maybe Dr. Shroff, you might answer that question and then pass it on to the next one.
Sure. Well, hello, everybody. Good afternoon, good morning, good evening. So happy to be here. So happy to be here for any of you who are celebrating at this time the Festival of Light. Happy Diwali to all of you. I am in the mother country, my mother country in India. So happy Diwali to all of you. May your light shine brightly and may your careers let your light shine beautifully. My early influences for global public health that really helped to get me motivated and inspired. I'll tell you one story. When I was just 19, I had a tremendous opportunity to work in Costa Rica. And I learned from women in this nutrition kitchen, this kind of soup kitchen, where I was doing some volunteer work about the reality of their lives. And it wasn't an easy reality to learn about. Most of them were single moms. Many of them didn't have alternative sources of incomes. So they would walk the streets at night to make money, survival sex, to feed their kids. And many of them would spend some of their very hard-earned money to buy Coca-Cola to feed their little babies, their little infants. And all of this went very contrary to what my 19-year-old self knew was good for their health. And so being able to spend time with people whose lives were really the people who I've always really cared about the most, and to really understand some of the reasons and the rationale why people are always making intelligent choices, the best choices they can, even though they might not look like the most intelligent choices. So that group of women really helped to inspire me to learn that throughout my career, the most important thing I can do is use these these little organs, my ears, and to learn really to always listen. And one of the gauges that I use now in my work is I think about the women in the village where my grandmother was born. She was born in Baroda in Gujarat. And those women who I met were very much like the women in my grandmother's village. So if I can have them as my gauge, then I'm on the right path. Thank you.
Thank you so much. Would you like to pass the baton to another person who might want to answer the question?
Sure, I'll pass it on to Prachi.
Thank you, Dr. Farah. It was very intriguing listening about your experiences, early career experiences. So, and thank you for this question, Alisar. I can talk about two experiences of mine that gave me these lessons, early career lessons about public health. And also these experiences, I would say, shaped my perspective about what I am currently. So around more than a decade ago, when I joined it was a BMGF, a Bill and Melinda Gates funded project in a remote area in India. So I was working for the maternal and child health care program. So I got this grassroots level experience of working with the nurse mentors who I was supervising. And it really gave me that experience of, hand holding is really important in healthcare work, what we were doing at that time. And also I learned the relevance of quick decision making for the healthcare workers, because their decisions were dependent on me. So these problem solving skills and I think I learned it from my nurse mentors at that time who I was supervising. So my second example would be, so it's not always the person who is supervising. So we are all learning in this field, I would say. The second example is one of my experiences from USAID funded project, and I think Wendy was talking about that when we started. So I was in the maternal and child health program, again funded by the USAID. It was called Vriddhi. So I remember going to office one morning, and just my colleague, she was working in a parallel program. So USAID had funded multiple projects. So she was in HR, human resources for health. And so we were in the state health office, so a provincial health office run by the government, but we were, as partners, were given a small space in the office. So we used to sit together. And she said that our project ended. Some meeting was held yesterday in US, and so they've said that all staff has to be retracted from India, and their job ended right that day. And whatever that remaining time period was there, they would be compensated for that. So, and the project was, I think, 2 to 3 years. When it was proposed as a project, it was 2 to 3 years, but then just a single meeting ended it. So I would say that this experience taught me that many a times we don't have the power to do anything. If the funding just ends, it ends. But it's not the same. I would also say that it's not just the silver lining, that it's not like that for every job. It's like the project jobs I was talking about. So for permanent jobs, teaching at universities, it's not the same. But I have mostly worked in these kind of jobs which just ends. So like a project cycle. So these jobs are like a project cycle which just ends with a life cycle. And hence I would like to end with this, that we have to continuously keep on upgrading our skills, because this is a very competitive field. So would be good to know what others think. I would pass it on to Nivi. Thank you.
Thanks, Prachi. Listening to Farah and yourself, I see so many similarities in our backgrounds, especially in the sense that I think as a community moving in this world of public health and global health, we are all similar in a way that we have a true north, and we have an axis that whichever it is for us, whether it's a village that reminds us of how deep our taproot goes into certain communities and cultures, or whether it's a single experience that reminds us of what our direction and driving force is. And I think that's really, really important. So it's a great question to start off with in terms of what happened very early in our careers that helped us to most understand how our public and global health journey has been influenced. And for me, I'm South African, born and raised, and my earliest formative experiences of healthcare was as a medical student, an intern, a medical officer, and then a practicing physician. In the front lines of my specialty was primary urgent emergent care in South Africa. And this was at a very politically transformative time, post-democracy, which happened in 1994. And it was really a fledgling democracy 10 years on when I had joined the ranks of medical professionals. And working in a very resource-limited and high-pressure environment, it really exposed me to this intersection of clinical medicine, socio-behavioral determinants of health, socio-economic determinants of health, and just the gravest system inequities. You really see how public health decisions, or rather the lack of them, public health policy and practice guidelines, or the lack of them, it plays out in real time, because you're on the front line and you're standing there asking yourself, what should I treat this next person with? How do I treat them? What do I do next? What investigation do I order? What medication do I prescribe? So really pragmatic questions, really very real circumstances, very tangible for me. And that often had life or death consequences. So here I was in my early 20s, mid 20s, at a crossroads. And it was really those experiences that led me to ultimately to epidemiology, research methodology, my master's degrees in research sciences like biostatistics, epidemiology, global health, and public health disciplines, where I realized that the power of data and of evidence is not just to describe a problem, but to eventually describe it in such a way that's rigorous, that any interventions to solve the problem is evaluated robustly, and that we report that and disseminate those findings in a really impactful ways that we ultimately shift policy and impact practice. So whether it's a simple surveillance system in a community hospital in a rural part of the Eastern Cape in South Africa, or whether it's designing multi-country trials across North America, the thread for me has always been understanding that there's this bridge between implementation and practice and policy, and further up the ladder, in terms of to those two worlds where you're at the making policy and decision-making level, and you're implementing it. And that bridge is where we play the most. And I think being able to cross those two worlds and being comfortable crossing that bridge is something that I'm still learning to do. But it's where I find myself now, thanks to those initial experiences on one side of the bridge and then a few on the other side. And now I find myself just living on the bridge.
Thank you so much.
So I think it's Wendy. I'm gonna pass it on to Wendy to bring us home.
Well, thank you all for sharing. What a panel to be a part of. I would share that two defining experiences in my early career were, one, serving as a community development Peace Corps volunteer. So I'm the only American on the panel. And so I was a Peace Corps volunteer early in my career, and that was certainly a defining moment. I worked with 16 remote villages in the mountain kingdom of Lesotho in sub-Saharan Africa. And then a second defining moment, opportunity, was I remained in the country after I concluded my Peace Corps service and led a team in the nation's capital at Lesotho Save the Children. At Lesotho Save the Children, I led the organization in developing a place of safety for children who were orphaned by HIV and AIDS at the beginning of that crisis. And by default, quickly we became a hospice provider for HIV-positive children. And we also helped form a coalition of child-serving organizations which assisted the government in rewriting child protection legislation, submitted reports to the UN, and undertook community-based research. Those 8.5 years that I worked and lived in Lesotho, really as a part of local communities, taught me that it is community members who drive change, and that government is often open to working with you to improve policies and programs if they are approached as partners and not as enemies. And that is something that has helped shape my career and really shaped how I work to influence and improve public health every day since.
Sorry, I was talking in the in the void. Well, thank you so much, everyone, for your very also like very interesting backgrounds and fields and coming from everywhere around the world. And it looks like there's a common pattern where we kind of start in women's health and realize that, oh my God, there's so much for the world to like go from there. And and here we are today. So thank you for your answers, and I think we can move on to the second question. And that one is about things changing. So we are in an era where the global health landscape is changing a lot. We are in a transitional era as well, where things like public health and global health have been very important. But after COVID, after the COVID pandemic, more and more people have started to get interested in public health and global health. And unfortunately, recently, we are seeing that there has been a lot of disruptions, whether they're good or bad, but this puts a big question for students or people who want to go into public health as to what can they do. So my question for you is that where do you see the biggest opportunities for future jobs in whether it's public health or global health or anything that is within that realm? And we can start again with Dr. Shroff if you want to.
Sure. My friends, I really encourage you to see global health problems as something that you really, really understand, to go really deeply into the understanding of whatever problem it is that really gives you some passion. A lot of us here work in women's health. I will work in women's health for the rest of my career. It is an unending area for me of great passion, and I will keep working on it. But in terms of figuring out for you where it's best to head, the most important area for you to head is an area where you think you can contribute. There is an unending source of problems in global public health. We have not solved issues of mental health. We still suffer from a massive disease burden of anxiety, depression, and a whole variety of other mental health issues. We have not solved problems of violence against women. All over the world, there are huge problems of violence against women. We have not solved problems of addiction. We have not solved problems of non-communicable diseases. The world is your oyster, really, if you want to think about things. And one thing I really encourage you to do is to think about where you can contribute and how you can contribute, and perhaps think about it in a way that is really new and different. I encourage you to think about the concept of social entrepreneurship. So how is it that you can think about a health problem in a way that can help people to generate income for themselves and do things that really are different? Because for you to think about just having a job and working for a standard employer, that might work and it might not work. Currently in this climate, it might be a big challenge to think about working for a standard employer. But if you think about global health problems as an entrepreneurial challenge, then there is no shortage of possibilities for you to do things. But really, the solutions to each problem rely in understanding the problem at the most granular level that you can, profoundly understanding every little grain of sand in that problem, so that your work starts from that place to find your particular niche in doing it. All right, so I will pass to Nivantha.
Thanks, Farah. I 100% agree with Farah in the sense that there has to be an infusion of you. And that's not as easy as it sounds, because at a young age, I can remember being in my early 20s, mid 20s, heck, even today, you know, as transformative a moment for humanity as it is right now in terms of global health and public health, we're on each of our own transformative journeys across our lives. And understanding who we are at a specific time point, what our personal priorities are and passions are, doing that introspective work is very important, and it's a sustainable process. It's a scalable process. It will change as you grow and as you evolve, as it should. So always do that. Always do that. Check in as a as a habit, as a practice. So that would be my first, I suppose. I suppose we were asked for advice in this question. So I think that would be my first piece of advice. And but to move it away from the personalized approach and to look at this more broadly, in the sense that, you know, global health and public health is in such a tumultuous period. I don't think that if we looked at it on the scale of time in itself, all time, it isn't. It's been this tumultuous for a long time. It's just been evolutionary in different aspects. Currently, with climate change, with demographic shifts and open borders, with infectious diseases and antibiotic stewardship and the evolution of resistance, in the age of digital health and information technology, including generative and agentic AI, there are more and more innovations, there are more and more adaptations, and these contribute to not just allowing the pervading inequities to persist, but they also make these inequities grow, so they become more apparent. Now, that can be seen in two ways. Yes, it's terrible, but we should also be able to recognize them better now. We should be able to describe them better. I think that in terms of opportunities for young early career researchers, early to mid-career researchers, the data science and digital health, especially in the age of information technology, is an essential tool in your kit. It wasn't when I started out. Back then it was called biostatistics. There are different names for these different sciences, and they evolve as time grows, as time passes. So you'll find that something that was called one thing 10 years ago, it's essentially the same thing with a bit more tweaks, and it's now called something else. I'll see Farah nodding, because we've probably been through, you know, real world data or patient-centered research being called several things, but essentially it's the same thing. There's just a few evolutions that you need to take note of. So data science and digital health is one aspect that is a key area for opportunities right now. Climate change and its association with health is a big one. As our climate impact accelerates, you know, new roles are emerging for global and public health in the interface between environmental science and public and global health. In that same breath, thinking about AI, everyone is, generative and agentic AI. Some of the issues around that focuses heavily on the environment, actually, and it's something we're not hearing enough about in the media in terms of its impact, AI's impact, not climate change's impact, on what AI's impact will be on climate change and the environment and how we're planning for that. Another big one that, you know, is pretty obvious since COVID, but it was prior to COVID. It's been even more so since COVID, and should always be a key area. And I think is definitely one that has a lot of opportunities, is emergency preparedness and health security. So it's no longer a niche course like it was when I did my degrees. It's no longer just, you know, a little small sub course in a much larger. It's a specialty in and of its own. It's a master's in and of its own. It's foundational to a resilient healthcare system. It includes everything now from epidemiologic intelligence and surveillance systems to supply chain management and logistics. So if you're thinking about a career in global health or public health, don't just chase job titles, chase problems. The most meaningful careers start at these like super messy intersections between the science and the discipline, the sectors and how they overlap that science and discipline, and the problem itself, and the various solutions that one can apply depending on the sector you're working in. I think that would be my advice. Stay curious, stay adaptable, keep your toolbox open all the time and constantly look for different skills that you can add to complement the established ones, and never stop learning. Always upskill throughout your career. So I'm going to pass it to Wendy.
Thank you. I love this question. I just want to say, I think this is one of my favorite questions. I loved the comment that someone earlier made. The question is, what do you see as the biggest opportunities? And I think these are opportunities. Change is an opportunity. And I know that there's a lot of folks who have been having meetings over the last year, webinars over the last years, talking about the fears and the problems and the kind of looking at all this, posing it all like as layoffs and closures at USAID as threats and huge concerns. And clearly I didn't lose my job. So that makes it easy for me to not be sounding an alarm. And so I do not want to in any way downplay the fact that there has been tragedies in what has happened in the global health sphere and the public health sphere as well, and that organizations have lost funding and people have lost jobs. But that being said, I appreciate the reminder that these are fields that have always been in flux. That these are, this is a world and a discipline that has constantly been addressing new issues, new topics, new challenges that has been ever challenged. They're fields that were founded to address challenges. So I think just beginning there, but the question is, what are some of the biggest opportunities? And so I want to talk about some opportunities that have kind of emerged just in the last few weeks, in the last month or so. And so folks may be aware, may not be aware, because there hasn't been a lot of fanfare around the fact that the U.S. State Department did release in, I think, mid-September, mid-August, in around August 18th or so. I may not have the exact date there, but in mid-August, released the U.S. State Department's America First Global Health Strategy. It was posted quietly, to be honest, somewhat quietly on the U.S. State Department's website. And then also, and that basically is saying what the U.S. State Department, which is a department within the State Department that is going to be overseeing the U.S.'s funding for global health, now that USAID no longer exists, what is going to be funded and what the strategy is for that, kind of what the structure will be for that. And likewise, just in the last week or so, Germany, who had substantially cut their funding, along with several other countries in Europe, has announced some substantial funding as well for global development, including health. And so there's some similarities around kind of the funding that's coming. So funding is going to start flowing again, and it's going to have some changes. So jobs are going to open up in the State Department, the U.S. State Department, to manage the new programming that the U.S. is going to fund. The U.S. is going to remain the largest global development funder for the short term, for a few years. And they're going to be hiring people through the State Department to manage the new programming. And very likely, based on nothing other than the fact that they got rid of the State Department, I'm going to venture to say it may not be a rehiring of USAID staff. It may be all new blood or mostly new blood. It's a very new agenda. So that certainly opens up the opportunity for new applicants. It's important, if you're going to be applying for those jobs, that you read that, that document and you know what they're looking for. Happy to chat with people about that. We might want to even schedule a session just about that. There's going to be more money directed directly to the Global South countries themselves, with a focus on frontline health providers and sustainability. Now, that's some good news for global health practitioners from the Global South. And it opens opportunities for out-of-the-box thinkers to help rethink and redesign how your countries will fund your health systems long-term. There's also some honesty in the plans from both countries, both the US and Germany, in the fact that there's priority being given for private partnerships and investments that boost Germany and the US's own economies. How that's going to play out, not really clear, but that may mean that there's some opportunities for health innovators in the US, in Germany, who are entrepreneurs to think about what's needed globally, what's needed in our own countries to do health better. And we don't need folks who aren't committed to health equity doing that on their own. We need people who are committed and who care, who want health to be done right, to be part of that entrepreneurship that's addressing those issues. Some other opportunities, there may even be some of the folks, I know there are some folks from some of these organizations who are on in this meeting today, on the webinar today. There are some really wonderful new programming that's being developed by nonprofit organizations, NGOs, particularly in the Global South right now, who are saying, even with limited funding, with small buckets of money, we can develop innovative, critical programming that's needed in our communities, because we know our communities best. We are from our communities, we live in our communities, we know our communities best. The Solomon Suniti Foundation in India, I know there's someone, at least one or two people here today, and you all can share your contact info or website here. They our long-term partner of Global Health Action, and they are doing some extremely innovative menopause funding. Menopause programming. Started out with just a tiny amount of funding that we were able to provide, seed funding, and then got a little bit more funding. Still need more funding to really take this to scale, but doing menopause programming with women who are really living on the edges of society in India. UDI, which an organization, and if they're not here, Charcy can share more information about their organization, but UDI, which is in Kenya, has an incredible organization or a program called Sex in the Park. Creative name, but don't Google it unless you have the link, because it'll take you to some interesting websites. But their Sex in the Park program is focused on providing sex prevention, unsafe sex prevention activities for and awareness for school-age children, particularly during school breaks, and is greatly reducing teenage pregnancies in their community. There's Women Volunteers for Peace, also located in Kenya, in Kisumu, Kenya, so further to the west, and they are sending girls who have not had family support. They are sending girls to tertiary schools so that they get an education and do not end up in the sex trade, but rather end up with job skills. And then one of our former interns, Abubakar Sekatuka, who has developed his own organization in Uganda, has 2 books right now on Amazon, herd trauma, H-E-R-D, herd, like a herd of cattle. And that is based on his lived experience in his own community, learning about trauma and how, particularly in his home village and in many of the places that we come from, but particularly in the global South, children do not grow up with a opportunity to boys to learn to have feelings and express them, and girls to have any role other than one of marriage and service, and that is often blamed on culture, but that culture actually is based in a cultural history of trauma, of colonialization, and that the trauma continues, and we have to break those cycles of trauma. And he's now working on developing a framework to be able to take this into schools and to be able to provide programming as well. He has started a nonprofit for youth and is working with youth in his community as well. So I'm just saying there are young professionals doing incredible work in their communities, and they're not letting anything stop them. So I think there are incredible opportunities to develop things, and when you develop something good, it will get funded, it will get picked up, and there are ways to change our world, change your world. And I just encourage you to figure out what your role is and go for it. My last little, and I'm gonna wrap this up, I promise, Alisar, that my last little piece of advice is, we all know that AI is here and it's hitting heavy. And if you're applying for jobs and you are using AI, particularly with your applications and or cover letters, know that AI is not as smart as it thinks it is. It still has its on a learning curve. I can't tell you how many applications we get that gets our name wrong. Global Health Alliance is a much larger organization on the World Wide Web than Global Health Action. So every time we get an application that says Global Health Alliance, we know that someone used AI to create their application materials. So just edit, check, and AI can be a tool, but don't let it be an excuse not to edit, what you're sending in to folks, and be sure that you are editing and you do your own research about someplace you're applying, because too often AI is going to not lead you down the right path, and they may even pull the wrong mission statement, or something else. So do your own homework if you want the job, or at least double check AI's work. So those are some opportunities and advice
Thanks,
that I
Wendy.
have in this transition period.
Thank you, Wendy. Nivantha, Nivi, did you need to say something?
Yeah, I
And
just
we
wanted
also
to
need to give Prachi also her answer. So
Yes, actually, let me just let Prachi go for her advice first. Please go.
I most of the points I thought about are already covered. I thought about these topics that are really essential. I think entrepreneurial plus the programmatic parts that you were talking about, importance of digital interventions, mobile technologies, medical technologies, mental health. I'm especially interested in that, but also climate change. Everything, I think everything was covered. AI, risks of using AI. But another thing I would like to add is, people who are interested in research, maybe they can apply for higher studies as well, or take up like lecturer jobs. So that's an evergreen field, I would like to say. So academia, you can go into that. So my advice would be to build your profile in the area you're interested in. So if you think that, okay, I want to do this, so start building your profile from early career, so that it helps you, when you're applying for any job or any academic positions. So that would really help you. And also networking and collaboration, so that really helps in the long run. So talk to people as much as you can. So that's all. Thank you.
thank you, Prachi. Nivi, you wanted to add something?
Yeah, 100%. I think that Prachi just hit the nail on the head there at the end. I mean, to build on what Wendy said at the end about AI, that was such an important point, in the sense that I think we could look at it very broadly and globally about the quality of work that we do and we apply, not just to our job applications, but to our public health and global health initiatives and endeavors in general, especially for the Global South. There's been a disparity within healthcare research where it's been done historically very poorly in certain geographic parts of the world. It's not been held to the same standard that it's held at in other parts of the world, because of the populations it's serving. So there have been these disparities and inequities within global health and public health. And if we're the future generations of professionals in this field, we really need to hold ourselves to a standard of excellence in terms of, it doesn't matter how small the program is. It doesn't matter about the scale of the program and how many people it's going to impact. Maybe it's only going to help one patient. That's okay. But the way in which it's done needs to be rigorous and robust, such that we're doing it well and its impact can then be applied at scale. Because it's a very, very important point Wendy made about, holding yourself and your applications, always checking. So when it comes to maybe advice as to what to do, starting broadly is a very good option in terms of understanding broad research designs, broad research methods before picking a specific design that you really like. Be wary of being pigeonholed too early in your career. Make sure, because the entire systemic factors up the chain in health, the healthcare system and the healthcare industry, let's call it what it is an industry, is very siloed. So be careful of being pigeonholed very early into one of those silos and just being pulled through those ranks. Make sure that in your early formative years, you move transversely and fill your toolkit with different tools and really ask yourself those questions of where do I feel most at home? Where do I feel most passionate? Where do I feel most useful? And then, you know, decide, oh, maybe now a PhD or a master's degree or a PhD, and move up in terms of the ranks, so to speak, but really try to start transversal and then move. And you'll see that the system is becoming, which I think is very good, less and less one that's vertical. Even the evidence pyramid itself is now not being looked at in a hierarchical or vertical route. There are pros and cons to every job title or every research design or every method. You don't have to be a clinical trialist, or you don't have to be a qualitative researcher. You don't have to be a nurse or a doctor or a social worker. There are pros and cons and limitations to every role. So you can't do everything with every role. And we all need each other. So in the end, we are a network. What Prachi said, when I said she hit the nail on the head, is ultimately the best advice any of us could give you is that you need to stay open to being in a team. You need to understand that achieving anything worthwhile takes a team. And you need to be really open to networking and collaboration throughout your career, because that's where global health and public health is headed.
Thank you so much, Nivi. It feels like two common themes that I found throughout all of your answers is one, just being genuine and true to yourself. And really just if something you're passionate about, go for it. And if, as you said, don't chase titles, just chase the problem and how you're going to solve the problem, and let that guide you. So thank you, everyone, for your very valuable insights and answers. And we'll move on to some specific questions for each panelist. And we are again going to start off with Dr. Shroff. And my question for you is that what are the biggest public health issues or barriers that you are directly working to solve or have directly worked to solve and what you're involved in?
I'm a public health generalist, so I've worked in many different areas, but currently I'm working on a few different areas. So I'll just talk about two or three of them. One is this huge problem of about 45 to 65% of all pregnancies on planet Earth are unplanned. And that's true in the country where I am right now in India. That's true in the country where I live, Canada. It's about half, 45 to 50% of Canadian pregnancies are unplanned. That might be shocking for a lot of you who know that you hear data about most of the forms of contraception being close to 98 or 97% effective. And yes, indeed, it is shocking, given that you would think that we really advanced, and we have in contraceptive methods. But yet people are often not using those methods properly, or they find them unsatisfactory. They also find that side effects of birth control are problematic for them. And many forms of birth control have side effects. So the big issue that we are doing is trying to promote a scientifically valid and yet almost universally underknown. It's not only a form of contraception, it's actually also a form of fertility planning that can help people to have a baby. It's called symptothermal methods. And it involves three different techniques. One is gauging cervical mucus. The cervix creates mucus or liquid on a daily basis, and that mucus is a high fidelity indicator for fertility. And the vast majority of people, doesn't matter who they are, don't know that fact. I've done these talks all over the world for people from many, many, many different countries. And these basic things really aren't very well known. So symptothermal methods uses cervical mucus as the primary indicator of fertility. The second indicator is basal body temperature, which is a little bit different than regular temperature. Basal body temperature requires people to have a special thermometer, which has double digits. So if you normally have a thermometer that shows your temperature of 37.6 degrees centigrade, the basal body thermometer would be 37.67 degrees centigrade, for example. So that's the second indicator. And the final one is the cervical os changes. Again, most people don't know that these are very, very easy things to find out about and very simple ways to do them. And yet they can help people to either have a baby or not have a baby. So our solution is to create an online course to teach people about this technique. And to create a social venture around it. The social venture is called Stretchy, Fertility Planning for All Couples. And we are going to be offering this course for free for anybody in any country who speaks good English. So you have to speak good English. The course will be offered in English, and who has a good internet connection. And this is going to be our pilot version of the course, and then we'll start charging for the course. So if any of you are in a couple relationship, we're teaching this to couples, because we are also tackling one other problem, which is that the vast majority of birth control methods are placed on the shoulders of those who identify as women. And we believe that this is a shared effort. And so in heterosexual relationships, we encourage both males and females to take responsibility. And so this course will be offered to couples and not just women, which is the way it's often taught, actually. So yes, that's one problem that I'm passionately engaged in with a fairly big team. And one of the team members is actually here with us, Dr. Yasmin Assad. She is one of the physicians who is working on the course with us. We have a very, very big team. The course has been primarily designed by physicians. Yeah, we're very, very excited about doing this. It's about 97% effective and has 0 side effects. It sounds almost too good to be true. And so the catch with this technique is that it does have to be learned. It's basically learning how to do data collection, like any scientific experiment. And that data has to be collected well. It has to be clean data, just like in any science experiment. So basically, our course is a science course. It's a science of fertility course. So that's one thing that I'm doing. Then I'm also really concerned about the current state of the planet, like many of us, the massive issues that we're all facing with the climate emergency and the heating of the planet. And so I'm working with colleagues at Harvard. This is almost exclusively a project that I'm doing with my colleagues at Harvard from many, many different disciplines. One of the colleagues is an M.D. PhD from the Harvard Medical School, another physician from the Harvard Medical School, an engineer, 2 engineers, actually. We have 2 engineers working on the project, and one faculty member from arts, another from science, another who is in the extension school. So yeah, this is a project that I invited only Harvard colleagues to work with me on it. And the question, the big question we're asking in this project is one of these very, very ambitious questions of how can we improve the health of the planet and simultaneously improve the health of human beings. And there are many, many different kinds of answers to this very big question, but the answer that we have come up with is to look at systems of traditional medicine, not which do healing in a one-to-one model. And the vast majority of healing systems in the world are on a one-to-one model. One healer, one person, one physician, one person, one nurse practitioner, one patient. And we're not using that model. We're using the model of collective well-being. And there aren't really that many of those around the world. We're looking at one system that comes from Zulu people in South Africa. It's called family constellation. And it's a very powerful, very, very transformative practice of healing people in groups. Family constellation practice can actually take up to 300 people at once and do something that shows us, and we know this in the literature, that when people heal, they don't only heal with a physician or with a healer, but if we give them an opportunity to be together with other people, that the peer group has a very potent impact on their mental, physical, and spiritual well-being. So that's what we're trying to harness in this project, is practices such as family constellation healing. I'll tell you the rest of the practices, and I won't describe each of them in such detail. But one of the other practices is from Japan, and it's called Shinrin-yoku. Shinrin-yoku has a cousin practice in Korea called Salim-yoke. This is a practice where a facilitator takes large groups of people out, typically into the forest. And there's a whole series of practices that are done in the forest. I'm a facilitator of this practice. So we do things in partners, we do things in small groups, but typically interacting with the trees, trying to come back to this idea that we are profoundly connected to nature. So Shinrin-yoku takes people into nature and tries to relearn this idea that we are children of nature as human beings. The whole project is precipiced on the hypothesis that most human beings have disconnected from nature. And yet virtually all of our ancestors, all of the 41 people on this call, all of our ancestors understood that there is a profound interconnection between all life forms, plants, animals, and humans. And so this project is trying to rekindle this ancestral notion of connection. And we are hypothesizing that when people learn through these 6 practices, family constellation practice, Shinrin-yoku, yoga from India, danza azteca from Mexico and other parts of Central America, and fa, which is a dance and music practice from West Africa, from Ghana. So using these collective well-being practices, we are hypothesizing that when people start to feel reconnected in their mind, body, and spirit themselves through a system which is lodged in a cosmological framework that understands that we are all connected, we are all one, we are all family, that then they will try to take more action to take care of the earth. So that is another big project I'm working on. I'm working on lots of projects, another one on music, lots of different ones. But
that's exciting. But it seems like you have your hands everywhere, Dr. Shroff, really. And thank you. I think all those, like the fact that you are involved in so many projects actually gives us an idea of what we could do. It's not just what we learn within a program or like an academic program or what we have around us. The world is big and we can do so many things. And so it's nice to get those ideas from everyone, and truly global health trying to learn from everyone as well. And we can move on to Nivi. I have a question for you. And that one is about
Health.
how do you prioritize working with communities and their populations to gain deeper understanding of their health needs, particularly, or just health needs in general, given, you know, your extensive experience and past experiences versus now?
So this is a really good question, and how I did this, or how I looked at doing this effectively and efficiently, and meaningfully and impactfully over the years has changed. And that it changed with my growth and evolution as a healthcare researcher, as a scientist, as a woman, as a person, and how I experienced healthcare systems as a patient and how I experienced them as a stakeholder in the system, a doctor, a researcher in my role, in my professional role. What I've come to learn is that I won't say it's the best way, but I think one of the ways that you can prioritize gaining a deeper, when you talk about depth of understanding, you always think about qualitative methods, because when you try to quantify something, when you try to measure something, at the end of the day, we have to understand the why behind what we're doing. So if we want to gain a deeper understanding of a community's health needs, we need to know our why. And our why is not just healthcare prevention anymore. We need to move away from public health being just about disease prevention. Public health and global health is about shaping the condition in which humans can thrive, the way Farah just described it. Being able to connect their mind, their body, their spirit, and thrive and choosing interventions that help them do that, choosing healthcare interventions and other interventions that help them do that. And that takes more than technical skill. That takes more than sciences like epidemiology, biostatistics, mathematics, data science, being able to code in R or Python. It takes humility. It takes resilience. And most importantly, what I learned is it means you question the norm and what is currently being done. Because each time we've improved on something, we questioned its current methods. We said, this is not being done right. It can be done better. And we did it better. So being able to ask questions and being able to challenge the status quo is a must. You have to have that. It means being resilient to a lot of people telling you, who do you think you are and what do you know? But yeah, you've got to do it. Because if you don't, we would never have shifted from these extractive research methods where we treat patients and people as research subjects to a more collaborative, inclusive model of community engagement and research that is now a collaborative one, where they are sitting at the table and are stakeholders and our researchers themselves being part of the methods, designing the study, the intervention, the whatever's being implemented. And being able to do that, like I said, it starts with humility and the ability to deeply listen to their needs first, not assuming what their needs are based on global priorities, not assuming what their needs are based on funding allocation, but really listening to their needs and what help means to that community locally, what thriving means to that community locally. And in pragmatic practice, as a researcher, this translates to involving communities from the design stage of anything, whether it's an intervention or a program, or it's just a data collection or a measurement exercise. They need to be involved from start to finish, not as participants, but as advisors, as partners, as co-investigators. We have to deeply respect their knowledge and expertise and their lived experiences. It also doesn't just mean humility, it means honesty. So if you're coming with funding to a community, you need to be transparent about expectations, about goals, about communication, and be willing to adapt and be realistic to what the actual outcome can be, not overpromising, because that really loses trust, and trust erodes community engagement so much. So what I've learned is that, to sum that up, working with communities and the populations, the people of those communities, to gain a deeper understanding of their health needs, to be able to address their health needs and implement, meaningful, impactful, long-term, sustainable, scalable solutions, is not a checkbox exercise. It's very complex, but it's again, it's a bridge between marrying robust science, rigorous methods, adapting them and making sure, challenging the status quo and making sure that they are the right ones for this community, and then keeping that human aspect within the science, the humility, the honesty, the transparency, the resilience. And when you walk that, when you walk that bridge, and you are that bridge between those aspects, it's when it works best.
Great. Thank you so much, Nivi. I think we get to learn a lot from, the people around us and where we start, and then moving on and maybe going from a smaller scale to a bigger scale. And I know that we are short on time, so maybe we can take one more question. And because you mentioned funding, and that was one of the questions. I think there was a question in the chat about funding, but also that was a question that we have for Prachi. And the question is, there are a lot of, because also it's something that Wendy also mentioned about funding. There are many barriers to getting funding as a researcher or someone who's trying to be part of global health and public health for those from low and middle income countries. And what are some practical steps that can help them overcome that barrier?
Yeah, thank you, Alisar. I think as a researcher coming from a low and middle income countries, we have multiple barriers, but I can talk about some of them. I think the most important one from my side, completely my opinion, is like publishing in high impact factor journals requires a good amount of article publication fee that sometimes we cannot afford if it is unfunded work. But if it is funded, we should budget for it. So that's how that's what the solution we have found is, we should always budget for that. But sometimes if we miss it or unfunded work, we do not get visibility in terms of publications, and that really hampers our future projects, because if you have publications, then only you'll get other projects, because funders always see that that is one of the major questions, that send you a list of publications, and so of the PI, being a PI or a co-investigator. So that is one thing. It's a challenge, but I think what we have found is like collaborating with partners from high income countries, or having capacity building as a component of our projects, whatever we apply for. For example, I can give you a quick example on, we got this project of Spark. So we collaborated with the University College London, where we kept a component of capacity building in evidence synthesis from UCL to Indian colleagues, like to Indian partners. So that really helped us, because that the funding agencies also want some extra component, along with one thing that Nivantha also mentioned about co-creation of evidence. So that is something we also want to work on, and it is really getting visibility these days in terms of funding. So the current project that I work on, the Resilience Collaborative, it's about co-creation with the healthcare workers for improving their mental health. So these are some of the examples. Having some known people in the funding agency can also help. Like you already know someone, but it does not guarantee, but it definitely helps getting funding sometimes, because they know your work. It's validation that is already there, that they know you. One of the, I can also talk about one advantage we have being in the global south, that the hiring costs that the cost that we budget in funding is like really low. I think when Wendy has talked about that. So we get that advantage because that overall budget is really low from our side as compared if it's a financial bid. So we have more chances of winning that because as compared to high income countries, the daily cost is really high. So that is one point I can think of right now. But yeah, open to any questions that come up. Thank you so much.
Thank you so much, Prachi. Loving all of your answers. I know we are very, very short on time, and I see that some of the panelists are answering some of the questions in the chat, and whatever questions that might be specific to you, you might answer. Actually, there's a question for Wendy. I know we had a couple of questions, but there was a question in the chat about you spoke about social entrepreneurship, and they would appreciate reference materials that would give them more knowledge on that. So do you have any material, or do you know of anything that might be useful to share with them?
Sorry, I had muted myself. Always struggle to find the unmute button.
It's okay.
We can work on pulling together some materials and sharing that in an email after the webinar.
Okay. All right. Thank you. Thank you so much. I know that we could talk on and on for the rest of the evening or the day for everyone. But I really just wanted to thank everyone for taking your time to answer those questions, give us some of your very valuable insights and very precious experience sharing. I just wanted to, we still have 7 minutes, so don't want to keep everyone waiting. So we're just gonna have a small wrap up. And before we do so, I just wanted to share with everyone some links. So I'll share my screen again so we can scan some of those QR codes. So if you are happy with today's event, we are trying to build more events of that, trying to pick up again the pace from last year. So here are 2 QR codes for you to scan. The first one is for joining the YLC, the Young Leaders Council. So if you're interested in joining us, we are a small group who's building slowly but surely, and you'll see everyone is super nice. I love working with everyone, loved meeting with everyone every couple of weeks. So if you're interested in that, please scan the first QR code on the left. And if you are interested in Global Health Action and what they're doing, you can sign up for their newsletter, and thus you'll get information of what is happening, some reports and what have you. So those are the two QR codes. You can also find Global Health Action on LinkedIn, Instagram, and Facebook. And as shared in the chat earlier as well, feel free to link up with any of us through LinkedIn if you want to take this conversation offline from this panel. We're all open to discussion, and we would love to hear from you. And with that said, we can go on to the closing remarks.
Well, from our side, from the GHA and the YLC side, we would like to just extend a big thank you to all of our incredible panelists for sharing all of your insights. Also, thank you to everyone in the audience for attending and for asking great questions. We look forward to connecting with you. You can also find us. We have been sharing the LinkedIn links of our panelists in the chat. You can also connect with them, and we do have a webinar in November, a Global Health Action webinar in November. If you are interested in attending, it's part of our webinar series, so you're welcome to follow us on our socials. Thank you, everyone. Until next time, take care. Hadi wakati mwingine. Hasta la próxima. Auf Wiedersehen. Bye.
Thank you so much, Michelle. Thank you, everyone. And was happy to connect.